in Haiti, I was responsible for anesthetizing patients so that they could have surgery.
My role was the orthopedic surgeon for Medishare. At that point, I was the first orthopedic surgeon to be there.
And I spent my time in Haiti after the earthquake. I came with the Bascom-Palmer Eye Institute relief effort, and we left 4 days after the earthquake occurred.
The memory that sticks with me is so many limbs mangled and crushed, and being able to anesthetize the limb so that it could be either saved or amputated so that the patient didn't get an infection and get sepsis and die was amazing. To be able to do anesthesia without any oxygen, without general anesthesia, and still be able to operate on hundreds of patients was so remarkable to me.
He couldn't eat or drink. He had IV in, and I gave him some little sips of water through a straw, and I said, "What's your name?" And he says, "My name is Louis." Later on that night, Louis was pronounced dead. We took him out to the morgue area, and he woke up. A doctor had pronounced him dead, but he woke up and he said, "The fresh air feels good," and then he died.
He was trapped in the rubble for several days, and his uncle pulled him out. He was in his 20s, and he had a bad hand injury, and also he had an injury to one of his eyes. He had what's called traumatic optic neuropathy, where the injury affected his optic nerve, and he had lost vision in the eye. And we treated him with corticosteroids intravenous for his optic neuropathy, and attended to his superficial wounds, and would round on him on a daily basis. And he became very attached to us. And then when I came back to the United States, he gave me the phone numbers of his family to call, and I was able to call his family, let them know he was okay. And that was the first they'd heard of him, so that was a really good experience too. So all in all, it was a really moving experience. There was just a lot of suffering and pain.
Besides the USS Comfort, we were the go-to people as far as if someone needed some help. Someone needed to bring a patient in, they could count on us to say, "Listen, we'll help."
The School of Medicine was extremely supportive, and they allowed their doctors and their nurses and their technicians to be away from work, and they accommodated us, and they accommodated our travel, and they supported us to set up a field hospital set up by civilians. There were other field hospitals that are set up by the military, but to set up a hospital by doctors and nurses and technicians, and that was set up a week after the earthquake, is remarkable, and it was an experience that I'll always have with me.
I think we were one of the main hospitals down there taking care of the injured.
The numbers are staggering in the sense that we've treated over 30,000 patients. We've performed over 2,500 to 3,000 operations. We've changed the culture of how our physicians and Haitian nurses that live there work, incorporating them into the hospital, trying to turn it over to them. They're not used to a 24-hour, 7 days a week coverage. They are now doing that with us.